Hello, everyone, and welcome back to Black Women Unmuted. I am Sonya Ross, the founder and editor-in-chief, and we are here to have another conversation with our dear friend, Dr. Melissa Clarke, about health empowerment and health policy priority number one for the people. Dr. Clarke, thanks for being here. We
Thanks for having me.
we value your expertise. And for those who do not know, Dr. Clarke is that sister. She's the one who knows what she is talking about when it comes to population health. She's a leader in that field. When it comes to health empowerment, she is an emergency medicine physician of several years. You know, she was the original toddler doctor out there, and now author, commentator, and host of, excuse me, Doctor I've Got What, which is a health empowerment podcast. So we feel very fortunate to have you here to give some valuable information to our audience.
Thank you so much, Sonya. I'm really happy to be here on Black Women Unmuted.
Now, let's just get right into it. Let's talk about we have a big election in front of us here,
Yes.
and in coming days, we will either be pondering the possibility come January of a President Kamala Harris or a repeat of President Donald Trump. Either way, what's been going on with us as a people out here is health. I like to call it a health emergency. we
Yes.
we are we are in dire need on a lot of fronts, from maternal mortality to overall chronic illness. So, can you set some priorities for the new presidency in terms of addressing these maladies for Black America?
Absolutely. Sonya, you mentioned maternal health first, so let's start there.
Okay.
When we think about reproductive health care, right, we know the lives of women are at stake. So, under a potential Trump administration where he has been associated with the Project 2025 agenda, we might further see women's reproductive rights and reproductive freedoms go back to pre Roe versus Wade lack of freedom, where we were having hundreds of thousands of women actually die from illegal abortions every year. And so, under a potential Trump administration, we might see something like a national abortion ban. We might see limiting access to abortion drugs. We might see investigations starting into abortion providers and medication manufacturers. As a matter of fact, we're already seeing a 62% increase in maternal deaths in those states that have more restrictive abortion bans. And so, from a maternal health standpoint, we know black women dying 3 to 1 uh, compared to white women in when it comes to maternal deaths. That's going to get worse potentially if we are in a more restrictive reproductive freedom environment, right? The other thing people don't think about too is just access to health care. More doctors and medical students are deciding not to go to those states with reproductive bans, reproductive freedom bans, right? So therefore, you're creating more healthcare deserts in places where people really need them. Um, so that's sort of what we might think about under a Trump presidency versus a Harris presidency, with Harris really upholding reproductive freedom. You mentioned in general to increase rates of chronic disease. Well, there was actually the three caucuses, the Hispanic caucus, the Black caucus, and the Asian Pacific American caucus within Congress came together and expressed concerns about health disparities. And health disparities specifically among those three groups, plus the LGBTQIA community, plus people in rural areas and low income communities. That's where we see a lot of health disparities happening now: higher rates of chronic disease, higher rates of uninsurance, higher rates of poor access to healthy food, breathing in polluted air, etc. And again, under Project 2025, we would see defunding of health and human services. We'd see changes in the CDC that would make it less protective of these minority groups and their health and healthcare access. And that would be a huge problem because it would set us back in terms of any progress that we've made when it comes to closing health disparities gaps. Um, and then I just want to close out talking about insurance, right? Because in minority communities, there's less access to insurance. So there are three key insurances: Obamacare, Medicare, and Medicaid, right?
Right.
So let's start with Obamacare. That's the Affordable Care Act, which has helped over 20 million people have access to health care because it provides dollars to help support the cost of purchasing health insurance. So those dollars actually got bumped up during the pandemic, but sadly, they're about to get repealed or taken back in 2025. So there has to be a vote, definitive action taken to extend those. Well, under a Trump administration, that would not get extended, meaning over 3 million Americans would lose their health insurance. Plus, we would also see everybody's premiums who are getting insurance under Obamacare, we'd see those go up. Under a Harris presidency, though, those would be extended. More people would be able to be insured. That's key for Black and Brown communities that are already having problems getting health insurance. So that's Obamacare.
Okay.
Let's go to Medicare. So for Medicare, I'm sure you probably heard Vice President Harris has a proposal to expand Medicare coverage for home health aides. That means it's easier for people to age in place. So those of us that have older parents, or if we're older individuals ourselves, we could actually get subsidies that would help us pay for home health aides. And how would Vice President Harris pay for this? By lowering the cost of prescription drugs that Medicare has to assume the cost of. So there would be a huge cost savings. That process already started under the Inflation Reduction Act. We've seen insulin capped at $35, um, per prescription. And so that would continue under a Harris presidency. Those savings would go towards the home health aides program. Under a Trump presidency, we really haven't heard a plan, right? We haven't
We've
heard
heard concepts of a
we've
plan.
heard concepts of a plan, but we haven't heard a definitive plan that specifically addresses Medicare, prescription drug prices, the Affordable Care Act, or how to make insurance affordable for lower income individuals. So that's Obamacare, Medicare, and let's end with Medicaid. So Medicaid is that health care coverage for individuals with low income or those who have disabilities. So under a Trump presidency, and we already saw this in the first Trump presidency, Medicaid programs would require that you work, that you're a working person, right? So what happens to people who have chronic disease and they're too sick to work, or are disabled and are unable to work? What would happen to those people? That would be a huge problem. Under a Harris presidency, that would not be a requirement. And as an emergency physician, I'm particularly concerned when we talk about coverage for individuals with Medicaid, because when they don't have coverage, people who are uninsured or underinsured end up in the emergency department because they're not getting proper preventive care, right?
Right.
So that bill ends up getting passed on to the public anyway. So you want to be more proactive in making sure that as many people have health care insurance as possible so that they can get preventive care and not end up in the emergency department. So those are the ways that I really see, all of these things disproportionately affect Black and Brown people, low income communities, and really are ways that things that we need to keep an eye on and be very, very cognizant about to make sure that we don't reverse any gains in improving the health and well-being of communities of color.
So now let's just say, for the sake of the discussion, that It's January 20th, 2025, and President Kamala Harris just took the oath of office. Should we realistically expect her to be able to do a whole lot uh, in the short window of grace that a new president would get on implementing programs, right?
Yeah.
Um, Either with or without a Congress that she couldn't work with? Should we realistically expect much of the health care reform or priorities that we need addressed right away to happen?
These things take time, right? But there are some things that she could do under executive orders. So she would not necessarily have to wait for Congress. But if she does have a Congress in place that she could work with, and I'm not saying, that it would have to be a Democratic Congress entirely, it would just have to be
Right.
a Congress she could work with, many of these things could be passed. So, for example, being more aggressive about negotiating Medicare prescription drug prices, like I mentioned before, which would make medications more affordable for those people that need them. That's something that could be passed working with Congress. The Health Equity Act, which the tri-caucus groups that I talked about are proposing, that already is proposed legislation that could be passed that would help, again, to fund programs that close health disparity gaps. So there are things that could be done by executive order, and then there are also things that could be done working hand in hand with a Congress that, wants to see these improvements happen.
Now, we've also had a conversation with a psychology professor to talk about the need for us to try to be mindful of our emotional well being, our psychological health, on top of our physical health. So, uh, given this completely stressful situation we have in this country right now, with all the angst and vitriol and around this election, at what type of physical ailments can manifest if the psychological uh health is not guarded as well as it should be?
Hmm.
I mean, should we be expecting, how realistic is it of us to say, well, we're not processing the stress very well, and we start seeing people dropping from true physical manifestations of that failure to take care of the mental health?
That's an excellent point, Sonya. That's that mind body connection. And if you're not on a daily basis taking care of your mental health and the anxiety that's coming about as a result of this election, on top of the normal stressors that we all deal with, we can start to see physical manifestations. Increased blood pressure is the first one. Increased blood pressure, again, leads to stroke, and it can lead to heart attack. We can see increased stomach acid production, which leads to heartburn and can lead to stomach ulcers. And in general, stress is associated with the worsening of any chronic disease you already have. So it could lead to worsening diabetes. If you're going through cancer care, it can make it more difficult for you to go into remission from cancer. Stress has overriding, or the ways that we not deal with stress has an overriding impact on our physical health in general. So that's why I say people should, on a daily basis, unplug, take time to do something that puts you in the present moment that you really enjoy. Meditation, playing an instrument, going for a walk, talking with your girlfriends, anything that helps to, take you out of that bubble of, oh my God, what's going to happen, and put you into a space where your body can relax, your stress hormones can come down, and your body can do what it's supposed to do, which is naturally heal and avoid those things that I mentioned before.
Those are some excellent points that you have brought up. Now, before we wrap up, I'd like to see if you can give us three solid takeaways from this conversation, or just something as we develop our post election recovery plan, where we can be most empowered about our health going forward.
Yeah, so I often talk about the five self health actions. So, one is managing the stressors in our life. So, I already talked about that. Um, Eating a healthy diet that doesn't promote inflammation. So, that's avoiding the high salt, high sugar, high trans fats diet and eating more healthy fruits and vegetables, as much as plant based that you can get. So, that's nutrition. Getting your 7 to 8 hours of sleep a night, making sure that you're well hydrated, and then moving every day. Because when you move, and I'm not just talking about getting exercise, just walking down the block, doing the honeydew list at home, walking the dog, whatever, movement actually helps to decrease the stress hormones in your body. So, those are the five self health actions. If we can focus on those, any one of those at minimum, that will help keep us in balance during this election season.
Now, did y'all hear that? The good doctor told you, take a walk, eat better food. Maybe I guess
Get your
ease up
sleep.
on
Get your sleep.
no more, no, three martini lunches, things
Right.
like
And don't
that.
use alcohol to try to get that better sleep because alcohol is disruptive to sleep, actually. So
Oh,
get it
okay, that's good
naturally.
to know. Okay, now where can people find you who'd like to know more about how they can become more health empowered?
So on IG, you can find me at Dr. Clarke. On Facebook and YouTube, you can find me at Dr. Melissa Clarke. And excuse me, doctor, my video streaming show is on my YouTube channel, Dr. Melissa Clarke.
All right, Dr. Melissa Clarke, thank you for giving us these keys to operate with. We feel like we're going to really be powerfully equipped to get ready for the post election phase and marching into the new administration in 2025. So,
All
thank
right.
you for being here.
All right. Thank you.